So these are, again, many of the symptoms. Let's look at some of the literature and research on carnitine. So I want to show you just some meta-analyses of multiple studies. You see here effects of carnitine supplementation on blood pressure, a systematic review and meta-analysis of randomized controlled trials. Very simply put, L-carnitine supplementation decreased DPB, that's diastolic blood pressure. So again, what is diastolic blood pressure? It is the bottom number. So usually when your blood pressure is being taken, the top number is systolic and the bottom number is diastolic. So again, L-carnitine supplementation decreased diastolic blood pressure by 1.162 millimeters per mercury. That may not sound like a whole lot, but it can make a big difference if you're also exercising and doing the other things that are necessary. You can see it also did this without changing systolic blood pressure. So at lower diastolic, it didn't affect systolic. Now, you can also see there was a subgroup analysis. The L-carnitine supplementation decreased diastolic blood pressure levels in participants with who are overweight and obese. So again, if you are an elderly person who's overweight or obese, the carnitine supplementation decreased your diastolic blood pressure 1.639 millimeters of mercury. So these are 2 gram per day doses. It did this in these meta-analyses studies. So in the conclusion, carnitine supplementation decreased diastolic blood pressure without affecting systolic blood pressure. And again, if you're in an obese category, it reduced your diastolic by about 1.6 millimeters of mercury. So again, you couple that with exercise, you couple that with better diet, that 1.6 doesn't sound super significant, but couple it with those other lifestyle factors, and you can get multitudes of point reduction even beyond that. Okay, let's look at this next one it's another meta-analysis of carnitine using carnitine supplementation for NAFLD. That's non-alcoholic fatty liver disease is what that is. So a major review of multiple studies showed L-carnitine supplementation may improve liver function and regulate triglyceride metabolism in patients with non-alcoholic fatty liver disease and with no significant adverse effects. Now, I think that's important to state, no significant adverse effects. How many of you, let's participate today. How many of you have been to your doctor, your triglycerides are high, you've been told you had fatty liver disease, and your doctor says, well, change your diet, maybe eat right, exercise, but didn't offer carnitine as a potential, right? Just answer below if you've been to the doctor and you've dealt with fatty liver and never heard of carnitine, or your doctor's never mentioned carnitine as something that could potentially help you. The reason I ask is because, again, a lot of the drugs that doctors use to treat high triglycerides and comorbidities associated around liver disease have risk profiles or risk side effects. Here we're talking about carnitine having beneficial effects with no significant adverse effects. And my opinion of things is that anytime you can do something natural or change your diet with no adverse risk factors that can improve your situation, that's always first line of where we want to try to go, as opposed to medicate. Now let's look at this. So L-carnitine, nutrition, pathology, and health benefits. Just a summary, this is a nice review paper. Carnitine deficit can arise in diseases such endocrine maladies, cardiomyopathy, diabetes, malnutrition, aging, sepsis, and cirrhosis due to abnormalities in carnitine regulation. Hypotonia, muscle weakness, motor skills, and wasting are all improved with L-carnitine and have reported to improve myocardial functionality and metabolism in ischemic heart disease patients, as well as athletic performance in individuals with angina pectoris. Furthermore, although some intriguing data indicates L-carnitine could be useful in a variety of conditions, including carnitine deficiencies it's important to mention this, caused by long-term parenteral supplementation or chronic hemodialysis. So parenteral nutrition, when you're in a hospital and you're bypassing the stomach and you're tube feeding basically, these individuals are at greater risk for carnitine deficiency, but so too are people going through hemodialysis. Now, what is hemodialysis? For those of you that have major kidney damage or kidney disease, hemodialysis is where you go in several times a week and they take your blood out of your body, run it through a machine to filter your blood because your kidneys are damaged. So it's treatment for people with chronic kidney disease or kidney failure, and it causes malnutrition. And one of the nutrients it can reduce or cause malnutrition of is carnitine, right? So, and that's not the only nutrient that hemodialysis contributes to deficiencies of. So those of you who are maybe diabetic and your kidneys are failing, maybe you're going back and forth to the doctor's office for hemodialysis, might want to have a conversation with your doctor about carnitine. Okay, now we have something we haven't really talked about yet, which is the review of literature on carnitine in the treatment of depression. And a big part of this is because a lot of the research that has been done so far on neurological diseases, the literature on this is not super robust, but there are some really good randomized controlled trials that have come out, and that's what this review was trying to summarize. This was published in Journal of Psychiatric Research. So you can see 4 randomized clinical studies demonstrated the superior efficacy of ALC. By the way, ALC is acetyl L-carnitine. Sometimes it's referred to, you'll see it as L-car in all caps, acetyl L-carnitine, short for that, but that's what is referring to ALC here. So again, demonstrated superior efficacy of acetyl L-carnitine over placebo in patients with depression. 2 studies showed its superior efficacy over placebo in dysmic disorder, and 2 other randomized controlled trials showed that it's equally effective as fluoxetine, which is an SSRI. So any of you that have ever taken a selective serotonin, too many S's here, selective serotonin reuptake inhibitor, SSRIs, again, showed that carnitine, acetyl L-carnitine, was equally effective as fluoxetine and amisulpride in treatment of dysmic disorder. ALC was also effective in improving depressive symptoms in patients with fibromyalgia and minimal hepatic encephalopathy. It was also found to be equally tolerable to placebo and better tolerable than fluoxetine and amisulpride. In conclusion, ALC may be potentially effective and tolerable next treatment option. So again, it's a little early to say for sure, but if you're struggling with depression and you're also struggling with tolerability of SSRI medications, you might ask your doctor, talk to your doctor about using acetyl L-carnitine. We'll talk about carnitine forms here shortly because there are different forms of carnitine, and some of them are better for different things. So we'll talk about that in a minute. Now we have this L-carnitine and acetyl L-carnitine roles and neuroprotection in the developing brain. There's compelling evidence from preclinical studies that L-carnitine and acetyl L-carnitine can improve energy status, decrease oxidative stress, and prevent subsequent cell death in models of adult, neonatal, and pediatric brain injury. Now, this is a big thing because there's a lot of pediatric brain injury, but there's not a lot of great treatment options. L-car can provide an acetyl moiety that can be oxidized for energy. Okay, so again, energy important. As a precursor for acetylcholine, what is that? Acetylcholine is the primary neurochemical that the brain cells use to communicate to each other. It's also the main neurochemical that your parasympathetic nervous system uses to communicate to your organs. So very important molecule, and you need carnitine, or carnitine provides, we'll say, special biochemistry for the production of acetylcholine. Incorporated into glutamate and glutamine, and into GABA and into lipids for myelinization and cell growth. So a lot of potential biochemical impacts or benefits potentially from using acetyl L-carnitine in areas of the brain and of the nervous system. Administration of L-car after brain injury in rat pups, and so this is, again, rat pups is mice. This is animal research. Okay, improves long-term functional outcomes, including memory. Additional studies are needed to better explore the potential of L-carnitine and L-car for protection of the developing brain, as there is an urgent need for therapies that can improve outcomes after neonatal and pediatric brain injury. So again, preliminary research, animal studies are showing great promise here. So, until we have more human trials, we won't be able to comment effectively for humans. But, I would just say, if you are in that type of situation where you have pediatric, maybe you have a child who's got brain injury and there's no other options and they're not offering any other alternatives, remember, carnitine supplementation is very safe. There's no downside to that. You may want to talk to your doctor about it. Okay, you see in this diagram, carnitine, as I said earlier, converts long-chain fatty acids into fuel, ATP. And where this is particularly beneficial is in exercise recovery and exercise performance. And there have been a number of studies, showing the benefits of carnitine supplementation. You can see in this one, this was a systemic review on L-carnitine in healthy subjects. And so L-carnitine supplementation improves body strength, sports endurance, and exercise capacity, as well as delaying the onset of fatigue. Where we see carnitine really be super effective if you're trying to exercise and trying to get in shape. Maybe you've turned a new leaf over this year and you're going back to the gym, etc. It's in the reduction of delayed onset muscle soreness, so improving outcomes with muscle soreness, but also in the increase of recovery. So improve recovery and reduction of soreness. Those are two very fantastic benefits that I have seen in a lot of clients as far as exercise is concerned. Typically, dosing is anywhere from 1,500 to 3,000 milligrams per day where it comes to exercise. But a lot of the research studies show that, around 2 grams a day, 1,500 to 2 grams a day, even lower than that, 3,000, can be helpful and beneficial for exercise performance and recovery. We've also got this study here. You can see effects of 9 weeks of carnitine supplementation on exercise performance, anaerobic power, and exercise-induced oxidative stress in resistance-trained males. So this is a study done in guys who work out, so it may not apply to all of you watching. But you can just see in a double-blind randomized placebo-controlled treatment, 23 men, plus or minus 25 years of age, ingested either a placebo or L-carnitine at 2 grams per day for 9 weeks in conjunction with resistance training. The outcomes: carnitine supplementation enhances exercise performance while attenuating blood lactate and oxidative stress response to resistance training. In other words, it reduced muscle soreness and it reduced fatigue. So, again, another research-based benefit of carnitine supplementation. Then we have this study, effects of L-carnitine on weight loss and body composition. This was a systematic review as well of multiple trials. You can see this looked at 37 randomized controlled clinical trials with dose response. Showed that L-carnitine supplementation significantly decreased body weight, mean difference of 1.2 kilograms, which is approximately 2.5 pounds or so. And then you see down here, 2,000 milligrams of carnitine per day provides the maximum effect in adults. So again, that's 1,500 to 3,000, but in this case it was 2,000. And then L-carnitine supplementation provides a modest reducing effect on body weight, BMI, and fat mass, especially among adults with overweight or obesity. And I would say this, if you're a young, fit athlete, male or female, and you think L-carnitine is going to, shred your body fat down to that ultimate goal, that's not typically what we see with carnitine as far as supplementation. It's generally people who are already overweight or obese that are raking in this type of benefit, not fit, healthy people. Now, again, there is improvement on delayed onset muscle soreness and recovery in fit people, but if you're taking it just specifically to lose weight and you're already relatively not overweight, then probably not going to see a tremendous change there, at least not based on the experience that I've had clinically. Now you can see in this study, this was carnitine supplementation for 5 weeks. You can see improves exercise recovery in men and women. And this was a randomized double-blind placebo-controlled trial. So in this study, 80 participants but between the ages of 21 and 65. So nice broad range group here. We're split into 2 groups, 40 participants each, a placebo as well as an L-carnitine group. 73 participants completed, so out of the 80, 71 actually got through the trial. The conclusions, though, these findings agree with previous observations among healthy adult subjects and demonstrate L-carnitine supplementation beyond 35 days is beneficial for improving recovery and reducing fatigue following exercise across gender and age. Well, okay, how do we take this and apply it to you, those of you watching who want to maybe potentially use carnitine? Let's say you're already working out and you're exercising and you're really struggling in your recovery. You're super tired all the time and you're not reaping the benefits from that exercise that you think that you should. Carnitine might be something that you want to look at. Again, doses may range from 1,500 to 3,000 a day, but in a lot of these studies, they're using 2,000 milligrams a day. If you look at, in this research study, they have a nice little graphic here on the potential benefits and effects on using carnitine, and that's increased fatty acid transport and oxidation. So in other words, it carries more fat into your mitochondria so you can make energy more efficiently and effectively. It increases endothelial function and O2 utilization, so it improves the flow of blood and increases oxygen. And then the potential effects, so these are cardiovascular effects mostly, and then these are muscle effects: increased carnitine content in muscle, increased endothelial function and oxygen supply to muscle, increased oxygen utilization and consumption of your muscle, increased fatty acid transport, reduction of lactate. Lactate's that chemical your muscles make that causes that burning sensation, that lactic acid. That's generally, because it hurts, it leads to you saying, oh, I got to stop. It hurts, it burns too much, it's time to stop and take a break. Well, carnitine reduces the accumulation of that chemical in the muscle, so theoretically could also improve your ability to get more out of your exercise routine. And then it increases antioxidant enzyme status within the muscle itself. So a lot of the potential benefits of why carnitine works, why it helps to improve recovery and reduce soreness, and also improve performance in multiple different ways. So if you're struggling, if you're a guy or a gal and you're struggling to recover from your workouts, you might consider L-carnitine in that light.